Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today, we're going to continue on that journey of Hashimoto's thyroiditis and the physiological web of dysfunction. So, Hashimoto's thyroiditis can impact female endocrine systems. So, let's go ahead and take a look. If you have Hashimoto's thyroiditis, because of the immune response and release of thyroid hormones or lack of release of thyroid hormones, it can start impacting the female hormones such as follicle stimulating hormone or FSH or luteinizing hormone or LH, right? So the impact of those hormones may be less or more, right? Then what happens is the receptor sites where these hormones go to, like the ovaries, become resistant, right? It's impaired. So we have one, there's an impairment of release of the hormones, and two, there's a impairment at the receptor site for these hormones. Over here, because of the release of hormones or abnormal release of hormones or the incorrect timing of release of the hormones, it can start to impact follicular development, right? The follicles that need to go down into the uterus and be ready for pregnancy. As we move along, we also know that Hashimoto's thyroiditis can impact hepatic biotransformation. Hormones need to go through the liver and be biotransformed, right? Sometimes you can have an excess levels of estrogen in our system because our liver is not converting them properly. So there is definitely biotransformation issues with your hormones, which impacts hormone dysregulation, right? Irregular timing of release, too much or too little of the hormones like LH, FSH, estrogen, progesterone, and so forth, right? Then what happens is you're going to get altered menstrual cycles. You may be infertile or infertility becomes a problem, or you may get pregnant and miscarriage becomes a problem. Oftentimes we see patients with Hashimoto's thyroiditis have multiple miscarriages. And it's because of this hormone dysregulation that brings them to this picture, right? Along with that, you're going to have younger females who have dysmenorrhea, right? They have irregular menstruation, they have a lot of pain with their menstruation, so it creates irregular or dysmenorrhea, right? In turn, what happens with this is that it starts to affect thyroid binding globulin or thyroid binding to protein, right? Thyroid hormones binding to protein. So it starts to impact how thyroid hormone will work. Essentially, when you have a thyroid problem, right, you have an endocrine problem, a female hormone problem, but the underlying mechanism is an autoimmune disease called Hashimoto's thyroiditis. So you have to address the immune function issues, you have to address the hypothyroid issues, then you have to start, addressing female hormones. Now, when we look at this, we have to say, where can we push and pull on this web? How can we have the most impact for a patient to affect this web and put it into balance, right? We have to know and understand the physiology, right? The physiology of dysfunction, right? In order to do that, you have to understand the entire picture, not just I have low estrogen or low progesterone. You have to understand the entire picture, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.